This presentation will go over the basics of bladder cancer surgery, what to expect, possible outcomes, and a general timeline. First, some background information about the organs of the urinary tract. The kidneys, seen here in orange, are in charge of cleaning much of our blood. They make urine out of any waste that our bodies want to get rid of. The urine is then drained from the kidneys through these tubes shown in green, called the ureters. The ureters then drain the urine into the bladder in yellow, where the urine is stored until you are ready to urinate. The bladder has three main layers, going from most shallow to deep. First is the urothelium, second is the lamina propria, and third is the muscle. Think of this like a rug on a hardwood floor. The rug is the urothelium, the rug pad is the lamina propria, and the hardwood floor is the muscle. Bladder cancer can happen when there are abnormal growths in the bladder. Smoking is the biggest risk factor for bladder cancer. Other causes include genetics, radiation, and exposure to certain chemicals. Bladder cancer is more common in men than women. In 2025, there were over 84,000 new cases of bladder cancer. TURBT is the name of a surgery and stands for transurethral resection of bladder tumor. This surgery can also be called a bladder biopsy and is used to both diagnose and treat bladder cancer. The surgery is endoscopic, meaning there are no cuts on the outside of the body, as everything is done inside the urinary tract. A long, thin camera is placed into the bladder by your surgeon through the urethra, and instruments are used alongside this camera to cut out tumors. At the end of the surgery, sometimes your surgeon may also place a chemotherapy medication inside the bladder through a urinary catheter. This can help to prevent return of the cancer. You will be under anesthesia for the entire surgery and can usually go home the same day right after you recover from surgery. The bladder is like a balloon. It stretches and grows as it fills with urine. Cutting out tumor will thin the wall of the balloon. While your bladder is healing, we do not want to put pressure on the thin areas. This is why that sometimes we may have to send you home with a urinary catheter for a few days to allow the thin parts of the bladder to heal. This is only done for safety reasons to prevent the thin areas of your bladder from popping a leak. So what's normal after this surgery? You should expect to see some blood in the urine, have bladder spasms, and have urinary urgency, frequency, and pain with urination up to a few weeks after surgery. However, it is never normal to have fever. Call us or go to the emergency department if you have fever, or call the clinic if you have symptoms that do not get better over time, so we can make sure you do not have an infection that we can treat. There are three main outcomes from surgery depending on the pathology or how the tumor that was removed looks under the microscope. If the cancer is low grade, we can start surveillance, which means about one cystoscopy every year. If the cancer is high grade, sometimes you may need a second surgery to make sure the bladder is completely cleared. And then you may need medication placed regularly inside of your bladder to prevent the tumors from returning, along with surveillance cystoscopies. If the cancer is invasive into the muscle or the hardwood floor layer, you will need to see the medical oncologists to consider chemotherapy and may even need a larger surgery down the line or radiation to treat the cancer. For high-grade cancer, to prevent it from coming back, you should undergo regular treatments in our urology clinic once you have recovered from surgery. The first round is called induction and involves 6 weekly treatments. A nurse will place a catheter in your bladder and instill a medication called BCG or gemcitabine or docetaxel into your bladder. It will dwell there for a few hours before you urinate it out to allow it to fully coat the bladder. After induction, if cystoscopy shows that no cancer has come back, you will then start maintenance therapies. So what now? After surgery, the pathologists will look at all the pieces removed by your surgeon closely under a microscope. They will let your surgeon know in about 2 to 3 weeks what kind of cancer and how deep into the bladder it goes. You will have a follow-up appointment with urology to go over these results and next steps. Remember, drink lots of fluids, avoid constipation, and avoid lifting anything heavier than 10 pounds for about 1 month after surgery. This can help to prevent bleeding issues and infection. Visit these links for bladder cancer support groups and more information. It's common to feel confused or overwhelmed. Bladder cancer care is very complex and takes time to understand. It's okay to have lots of questions, and you should focus on taking things one step at a time. Your urology team is here to guide you, answer your questions, and support you through every step of the way.